If your doctor said you have hypertension, don't skip this test. Number 3 could save your life. Here's what most people do not know. High blood pressure is more than the number on the cuff. Your doctor or primary care provider needs to find out why and if organ damage has already started. So he's going to send you for a couple of tests. Your primary care provider is going to send you for 4 categories of tests. Number 1 is to check your kidneys. Oftentimes, your kidney is the cause of high blood pressure as well as the victim of high blood pressure. So he's going to check for electrolytes, sodium, potassium, calcium. He's also going to look at your creatinine level. This tells us if your kidneys are filtering properly. Then he will do a urine analysis just to see if there is protein in your urine. He may also check urine albumin to creatinine ratio. Here is why all these tests for kidney function is needed. When there is kidney damage, it can lead to high blood pressure. And a kidney that is already damaged can cause high blood pressure. It's more or less like a vicious circle. The second category of tests that he's going to send you for is a metabolic screening. This is to check if there is a connection to diabetes or elevated cholesterol as well as thyroid problems. So you're going to have to do a fasting blood glucose or an A1C testing or a random blood glucose, sometimes oral glucose tolerance test. He's also going to send you for a cholesterol panel. I talked about cholesterol panel in previous videos. And he will check your TSH. This checks to see if a thyroid dysfunction is causing your hypertension. There is a shocking statistics to this. People who have hypertension and diabetes have 2 to 4 times higher risk of having a stroke or a heart attack. 1/3 of hypertensive patients have undiagnosed prediabetes. The third category of tests is the heart damage check, and this is very critical. You will have an EKG, some people say ECG, it's called an electrocardiogram, sometimes even an ultrasound of your heart called an echocardiogram. And this is why your heart has been pumping against high blood pressures, sometimes years even before you were diagnosed. So when we do an echocardiogram or an ECG or EKG, we're looking to see if your heart muscles have thickened, something we call left ventricular hypertrophy, or if you have irregular heart rates, which we call atrial fibrillation. This usually predisposes people to stroke. Or if there are any other silent damages that has happened to your heart. Studies and statistics show that 25 to 30% of newly diagnosed hypertensive people already have some heart changes in their first EKG. Category 4 of the tests that you will do are other tests that include your complete blood count, which looks for anemias or any blood disorders, as well as checking for uric acid levels, because elevated uric acid levels have actually been linked to resistant hypertension. Here is a fun fact. Elevated uric acid levels in 25 to 60% of untreated hypertensive patients can predict who will develop hypertensive complications. Here is the bottom line. These tests are not boxes that you have to check. You are creating your own personalized roadmap, which will tell your doctor if your hypertension is primary or secondary, if any organ damage has already started. It also gives them an information of what kind of medication will work for you, as well as what other conditions need to be treated alongside your high blood pressure. If you have a diagnosis of high blood pressure, you know what tests you should be getting and why. If you still have questions about your high blood pressure workup, drop them in the comments below. Follow me for my next video.